Hi everyone, I'm Kirsten Homan and this is your Park Ridge edition for December 5. For more than 50 years, Toys for Tots has been giving Christmas to kids who might otherwise go without.
When I came here in 2003, we started collecting toys for the Marine Corps Reserve, which they do every year, so that kids in our community can have toys at Christmas.
Over the years, this brightly decorated box has become a holiday fixture in the lobby of Park Ridge Health, giving Park Ridge team members a chance to give back during the holiday season. These toys are just a small part of a larger effort that touches lives around the world.
There's a collection and distribution center in Hendersonville, and they will come and pick up the toys, and then they get distributed throughout the county to the families of and organizations that we know have a need.
The holiday season is in full swing, and for many that means Christmas cookies, football, and lots of turkey. But to a brave few, it means training for the upcoming Frostbite 5 and 10K. We now go live to Fletcher Park, where field correspondent Charles Cutler is standing by.
Thank you, Kirsten. I'm here at Fletcher Park surveying the course for this year's training for the Frostbite 5 and 10K race. Park Ridge's wellness team has been tasked with training any participants who want to run.
We're going to do a 10-week program as opposed to some 6 or 8-week programs, so we stretch it out a little bit farther, make people a little more comfortable about getting ready to run in February, especially because it's a cold month of the year, and I think people are intimidated by that.
Besides rock-hard abs and incredible quads, participants in this year's Frostbite event will receive a long-sleeve wicking shirt along with 10 wellness points for completing the Frostbite race.
We really want to encourage people who have never ran, have never even really thought of running or thought of themselves as a runner, maybe someone who finds themselves wanting to try something new. This program would definitely be for them.
Training starts December 11 at Fletcher Park.
Thanks, Charles. Park Ridge Health is coming in first in the race for quality care. Adventist Health System recently applauded Park Ridge Health for topping the charts in patient experience. Recent results of the HCAHPS survey puts Park Ridge in the green for 9 out of 10 measures, thanks to all Park Ridge team members for bringing care to a world-class level.
It's a combined effort by everybody in the hospital, from the nurses to the case managers to the emergency room physicians to our surgeons, obstetricians.
Team members have been working especially hard to improve patient experience during hospital stays. Often it's as simple as answering questions.
In line with that, we always try now to say at the end of our conversation with the family or patient, did we answer all your questions? And give them every opportunity to say, well, I am thinking about this, and I didn't want to bring it up.
Bringing stools into each hospital room has made these types of conversations more comfortable for patients and their families.
If you're standing at the bedside, they get the feeling you're in and out.
Simple changes like these have added up to a big difference.
We have to have patients that walk away from this hospital and say, I want to go to that hospital. It's not just because the ambulance is going to take me here. I want to ask the ambulance driver, please take me to Park Ridge.
Park Ridge Health is taking care into the community more than ever before through an exciting new program.
Community Health is a new venture here at Park Ridge, and this year we have grown from 17 facilities to over 40. We have medical directorship out of the 9 skilled nursing facilities. We have medical directorship now in 6 of them.
The new program brings together services that are in high demand in the community and at long-term care facilities, including geriatrics, podiatry, wound care, home health, home medical equipment services, and psychiatry, one of Park Ridge's most sought-after specialties.
Dr. Julie Iacono is our first full-time psychiatrist stationed in the field, and so that's an awesome thing to provide for the community.
A new direct admit program allows Park Ridge physicians out in the field to admit their patients directly to Park Ridge Health for conditions like pneumonia without going through the ER.
Taking the services to the community, and in that way when there's a need for hospitalization, those patients can come and to our hospital we have continuum of care.
It's time for another episode of Who's That?
I'm very happy.
Good. He's here, he's there, he's everywhere. Meet Mark Merle, Park Ridge Health's new business manager for surgical services, the emergency department, and ICU.
A typical day is probably, I like to make sure I get into the clinical areas that I work with, in surgery, OR, PACU, just to see how things are going, to make sure everything's running smoothly from an efficiency.
Efficiency's the word, but Mark is also here to help.
It is a new position. It's that we want to allow our clinical leaders to be able to do what they train to do and what they love to do, and that's focus on the clinical aspect, being with the patients, working with their clinical people.
A few months in, Mark says it's easy to call North Carolina home.
I come from Chicago, so it's totally different. I like that. It's very much, it's a slower pace. It's a little bit more family oriented. I love the community.
But most of all,
I love sweet tea. I had to go to Subway in Chicago to get sweet tea. So anytime I wanted sweet tea, I had to get a $5 footlong.
that is your Park Ridge edition for December 5. I'm Kirsten Homan.